Good afternoon, everyone. We're going to go ahead and get started in the interest of keeping everybody on time. We have a brief presentation today where we'll talk about immunizations as a MIPS quality measure. My name is Lindsay Pluff. I am a Senior Quality Improvement Facilitator with Telligent. And today we have combined with a number of different QIM QIOs who work on the immunization project to bring this to you. We have Telligent, we have Gina Jones and myself. From Health Insight, we have Deepthi Rajiv. From Alliant Quality, we have Libby Messiah. From MPRO, we have Michelle Dewey and Barb Link. And from Adam Alliance, we have Rebel McKnight. And we wanted to do this to kind of get our message out to a wider audience. So Michelle Dewey from MPRO will be doing our presentation today. Michelle is a quality consultant and works for the Centers for Medicare and Medicaid Services, Increasing Adult Immunizations, Quality Payment Program, and Transforming Clinical Practices Initiative. Prior to joining MPRO, Michelle worked as an office manager for a physician's office, where she implemented many quality payment models, including meaningful use and the physician quality reporting system. She joined MPRO in December of 2015, where she continued to assist and educate clinicians with these programs. Her latest responsibility is helping practices with the transition to the quality payment program. So just before we get into Michelle's presentation, just a few pieces of housekeeping. Please make sure that you are putting yourself on mute. If you have any questions during the presentation, you can feel free to send them either to the panelists or to the participants at WIDE through the chat function. We will be answering questions at the end of the presentation. And again, just make sure that you put your phones on mute. All right. So Michelle, I'm going to pass the presentation to you, and we can begin. What? Tomorrow?
Okay. Thank you, Lindsay. Good afternoon, everyone, and thank you for joining us today. So today's focus is going to be on immunizations and how you can integrate vaccines, specifically flu and pneumonia, into the quality payment program. There seems to be a lot of focus with different organizations out in the community with the same goal, which is to increase immunization rates, not only in children but in adults as well. Ultimately, this is to prevent disease and to protect our patients. So in order to measure our efforts, data is an important piece of the puzzle. So that's where the immunizations meets quality reporting. Today I'm going to give you a very brief overview of the quality payment program and show you how vaccines can be utilized in this program. I'll also show you a tip for selecting measures that will best fit your practice. So, first, the Quality Payment Program was created by the Medicare Access and CHIP Reauthorization Act of 2015, and it's a new approach to paying physicians and clinicians who treat Medicare beneficiaries. The Centers for Medicare and Medicaid Services merged the aspects of the Physician Quality Reporting System, which is PQRS, the Value Modifier Program, and the Medicare Electronic Health Record Incentive Program, which is meaningful use. So they merged all of those together to create the merit-based incentive payment system, which is known as MIPS. So MIPS has 4 categories. It includes 4 performance categories, and they're each weighted differently with different percentages. And they're different for 2017 and 2018. So for the 2017 reporting period, quality is 60%, improvement activities is 15%, advancing care information is 25%, and cost is 0 for 2017. For 2018, the quality will be bumped down to 50%. Improvement activities is the same at 15%. Advancing care information stays at 25%, and then cost will now be at 10%. So who is eligible to participate in MIPS? For 2017, so the thresholds, again, kind of with the performance weights, and they've changed from 2017 to 2018. 2017, clinicians with 30,000 or more in Medicare Part B claims, and if they see 100 or more Medicare patients. For 2018, the requirements are much higher. Clinicians with $90,000 or more to Medicare Part B claims, and they have to see 200 or more Medicare patients to qualify. The types of clinicians that are eligible are physicians, physician assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthetists. Okay, so we're going to first start with quality. The quality care category replaces the PQRS program and will make up 50% of the MIPS score for 2018 reporting, and then 60% for 2017. Individuals will report 6 measures, which will include 1 outcome measure, and groups will report on 15 measures. If you're having trouble deciding what measures to report on, you can go to the QPP website and you can filter by your specialty, which you can see here on the slide. The quality category and improvement activities both have this option. So you'll just click on your specialty and it will give a list of all the measures that best relate to your specific specialty. But today I'm going to talk about how you can easily integrate immunizations into the quality payment program no matter what your specialty is. And really, immunization status can be assessed no matter what specialty. So if you're not stocking the vaccine and not giving the vaccine, you can still assess and then refer the patient to a pharmacy or a health department or back to their primary care provider and still report on that measure. So, do you mind if I just give you one? Touch my hand, but hearing a little bit of noise in the background there. So the CMS Quality Payment Program features a couple of quality measures focused around immunizations. The first one is the preventive care and screening for the influenza immunization. So by selecting this measure and working to improve these measures, you can support the care you are providing to your patients to prevent your patients from contracting the flu and spreading it to others. This measure includes patients 6 months and older who were seen for a visit between October 1st and March 31st, who received a flu shot or who reported previous receipt of the vaccination.
UIS.org, and she can assist you with any questions on CE. Now, we would like to go ahead and introduce one polling question here to figure out who's attending the call today.
Can I go ahead and finish?
I think so. It looks like maybe we were snuck in with another presentation.
Okay. Anyway, moving along here, we're on the influenza numerator slide. So, the numerator will be the patients who have received the influenza vaccine in your office or who have received it previous to their visit. So previous receipt would include the patient being vaccinated elsewhere, like at a pharmacy or a health department, but it must be within the current flu or the season and can be given as early as August 1st.
Can we go with October 1st? I think it's just the MIPS is part of the clinic piece.
Hi, we are hearing some background noise. If you can please place your phones on mute, we would appreciate it. Thank you.
Okay, so now the influenza denominator. The denominator is all patients 6 months and older who were seen for a visit between October 1st and March 31st. And there are a few exclusions here. They include a patient allergy, if a patient declines, or a system reason. And a system reason would be that the vaccine is not available due to a supply shortage. Okay, so reporting methods for the influenza measure. Quality measures or any quality measures, they can be reported several ways. Through your EHR, but there's so many different vendors, you'll want to reach out to your vendor for the specifics on that. Through the CMS data submission system, a registry such as the MIPS Wizard, or through claims. So for claims, you'll need to add one of these codes that are listed here in order for CMS to know that you're reporting on that measure. I highly recommend the CMS data submission system. It's very similar to attesting for meaningful use, and that is now live on the QCP website as of January 2nd, and it closes March 31st. And you can find that at qpp.cms.gov/login. All right, so another adult immunization quality measure is the pneumococcal vaccination status for older adults. So this measure includes patients 65 years of age and older who have ever received the pneumonia vaccine. Again, the numerator will include patients 65 and older who have ever received the pneumonia vaccine. And this includes either the PPV13 or the PPSV23. If the patient received the vaccine outside of your office, like at the pharmacy or the hospital, a health department, you can still get credit just simply by documenting in the patient's medical record. So the denominator includes patients 65 and older with a visit between January 1st and December 31st of the reporting period. If the patient was in hospice or was deceased during the calendar year of the reporting period, they would be excluded from this measure. So the reporting methods for the pneumonia measure are the same as for influenza through your EHR, the CMS data submission system, a registry, or through claims. And again, I highly recommend the CMS data submission system. For those of you who have attested to meaningful use, and I've had experience with attesting for the meaningful use program, it's just very easy to use. So I would recommend that way. And so to wrap up the quality measures, these can be easily achieved by assessing your patients for flu and pneumonia vaccines, giving the vaccination if needed, or referring to a pharmacy or health department if you do not stock the vaccine. As always, remember to document in the patient's medical record and into your state immunization registry. Okay, so now we're going to just briefly talk about improvement activities. In this category, participants will attest to completing up to 4 improvement activities depending on the weight of the activity. Groups with less than 15 participants, or if you're in a health professional shortage area, you will need to attest to completing 2 activities. If you are a designated patient center medical home, you will automatically receive full credit for this category. So 2 examples of improvement activities that can correlate with immunizations are the measurement and improvement at the practice and panel level and participation in population health research. All right, and the next category is advancing care information. So this category replaces the Medicare Electronic Health Record Program, which was also known as Meaningful Use. And this will make up 25% of your MIPS score. Again, with sticking to the topic of how immunizations can play a role in the quality payment program, I'm just going to tell you about 2 measures that relate to vaccinations in the advancing care information category. One is using the Immunizations Registry for reporting through your state. The ultimate goal of using your state immunization information system, or IIS, is to submit and receive information forecasts and histories from this portal. In Michigan, ours is called the Michigan Care Improvement Registry, or MICR. Many states do not require clinicians to enter adult data into the IIS, but it is strongly recommended. Entering vaccination data will allow for sharing immunization records between provider offices and will reduce over-immunization when practices use the IIS for assessing the patient's vaccination status. Another way to integrate immunizations through this category is to provide patient-specific education. So depending on your electronic medical record vendor, a variety of patient education is available and can be printed or sent through the patient portal to your patients. So choosing material focused on the benefits and importance of vaccinations will encourage patients to get immunized, especially because it's a strong recommendation from their doctor who they trust. All right, so I just wanted to briefly mention that for 2017 reporting, you can pick your pace. So if you just do number 1, the submit something, just by submitting one quality measure or one improvement activity, you can avoid a negative payment adjustment. So again, with keeping immunizations in mind, an example and a really easy way to fulfill this would be to submit the numerator and denominator for the flu or the pneumonia, or you could do both of those quality measures that I talked about earlier in the presentation. So for 2017, it's too late to do the reporting through claims, but you still have until March 31st to register and report through the CMS data attestation system. I also wanted to mention that if you're participating in an accountable care organization or an ACO, you will receive full credit for quality and partial or full credit for improvement activities, depending if your alternative payment model qualifies. So, and I mentioned this earlier, but if you are participating as a patient-centered medical home, PCMH, you will also receive full credit for improvement activities. And here's just a visual, a timeline for QPP for the year 2017. So you'll submit your data by March 31st of 2018, and that could even just be that one quality measure or two quality measures, flu and pneumonia, to avoid a negative payment adjustment. And then you'd receive your payment adjustment starting in January 1st of 2019. Next, we have just some resources and tools for QPP help. There's a Quality Payment Program Help Desk. They are available by phone or email between 8 a.m. and 8 p.m. And then also the Quality Payment Program website is a great resource. It explains the program very nicely, and there's even a tool where you can look up your MPI number to check your participation status in the program. And always feel free to reach out to your quality improvement organization in your state, which those contacts are listed on the first page of the presentation. So now I will turn it over to Lindsay, and I thank you all for your time today.
Thank you so much for that great presentation, Michelle. We wanted to leave a little bit of time for any questions that you might have for Michelle or for any of the other Quinn QIO representatives that are on the phone. So please make sure to write your question or to let us know that you have a question in chat, and then we can either call on you or address your question through the chat. Are there any questions?
Are these slides available?
Yes, we will be emailing the slides to everybody who participated.
Thank you. Michelle still qualify, and Darlene might qualify. And Rainey won't qualify because she didn't see enough adult patients who are on.
Any other questions? All right, it doesn't seem that there are any other questions. So if not, thank you all for taking time out today to participate. Please let us know if you have any questions. You can reach out to us at any point. And again, we thank you very much for your time.